Welcome to the Group Dentistry Now show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show.
I'd like to welcome everyone to the Group Dentistry Now show. I am Bill Newman, and as always, we appreciate you tuning in. We are well over 200 podcasts and just going strong. So without great listeners like you, we couldn't do it. And it's a lot of fun. Always have great topics and actually have two new guests. We have a lot of returning guests to the podcast. We have two new guests to our podcast here, and we're going to focus on automating patient and payer payments to reduce AR. We'll talk a lot about RCM, and really like to introduce to you first Donna Ramadan. She is the Vice President of Revenue Cycle Management and Compliance for Great Lakes Dental Partners. Donna, thanks for being on the show.
Hi, Bill. Thanks for having me.
This is going to be a really fun conversation here. And Donna has a really curious background that we're going to have to dig deeper on. She is a registered nurse. She has ICU and trauma clinical experience. Then she decided to get her master's in business administration and spent a lot of time in revenue cycle management in medical and hospital systems. So we're going to find out all about that and how that might differ compared to the dental industry. And we also have with us Ryan Merriman. He is a senior enterprise account manager at Rectangle Health. He's been with Rectangle for 6 years, and it's funny, I was reading the bio he sent over, and he says, from boots on the ground, knocking on doors and climbing under desks to plug in devices to working with our top strategic accounts like Great Lakes. So Ryan, great to have you here as well.
Thanks for having me, Bill. Excited to be here.
Yeah, this is great. Donna, why don't we start off with you? Would you mind kind of giving us a little bit of your background, maybe starting at that, as an RN, and then the switch over to getting your master's and maybe your journey in revenue cycle management and to the dental industry?
Yeah, for sure. Thank you. Yes, as you mentioned, I'm a registered nurse. I think I was genetically required to be. My great-grandmother and my mother were both nurses. I really enjoyed being a bedside nurse. And as you had mentioned, I worked in the ICU and the trauma unit. So I always tell people nothing scares me. So I was at the bedside for many years, and then was invited to move into a leadership role where I ran a 38-bed inpatient unit. From there, I moved to the outpatient side and ran an occupational health unit or department. And that was my first kind of exposure to what we now know as revenue cycle. It was like my own business. And so I had from the beginning through the end of billing, coding, all of that. And that really intrigued me, beyond the clinical component of nursing. So it was at that point I went back to school and got a master's degree in business, and then explored other opportunities. And I first started off as a patient access director at a hospital. And then that quickly grew into me being the leader over the entire revenue cycle. I've been on the hospital side my entire career, from small community hospitals to large academic medical centers. I was at the Cleveland Clinic for a number of years. And so I transitioned into the dental space about 3 years ago.
And for some in the audience that may not know about Great Lakes, a little bit about the group that you work with.
For sure. We are a 28 office DSO. We are headquartered in Chicago, Illinois. Most of our practices are in the Chicagoland area, and we have 5 in Northwest Indiana. Mostly general practitioners, but we also have every specialist from orthodontics to oral surgery to periodontics and prosthodontics.
Excellent. Thank you, Donna, for that. Ryan, how about you? A little bit about your background, and can you also tell us about Rectangle Health?
Well, thank you, Bill. So my name is Ryan Merriman, and I am a senior enterprise account manager here at Rectangle Health. And that's kind of the beauty about our company is we have different divisions depending on the scope and the size of the accounts and the organizations we're working with. So I strictly work with clients like Donna, like Great Lakes Dental Partners, mainly your DSOs, anywhere from, you know, 10, 15 locations to 300 locations. Um, so that's kind of where I'm at today. How I started, I know we talked about in the bio is, I've been with the company for about 6 years. Prior to my current role, I was driving 3,000 miles a month, in my state, which I grew up in. It's Oklahoma. Very proud of that. I'm a Oklahoma country boy. And, as our software has grown, as our company has grown, there's always, that's kind of the beauty about our company is within the company, there's growth for different levels of the clients we work with. So today, enterprise account manager, I actually started off working for Rectangle for a pretty cool, I like to say organic reason. My wife, my father-in-law owned his own dental practice for 25 years, and my mother-in-law was his office manager. And one of my really good friends worked with Rectangle Health in California, and I told him I was moving back home. I kind of said, what I was interested in. Obviously, wanted to be, kind of more at home with my family and still be able to do something amazing. And once I really learned what Rectangle Health does, everything that we do as an organization, as a company, is to simplify the business side of healthcare, right? Is make life easier for our end users. Um, you know, Everything we do is focused on, the end user, the office manager, whether that's, organizations like Donna, right? If you're talking about dealing with a lot of locations at scale, that's kind of why I love Rectangle Health. Is every software update that we implement is specifically designed because we've heard a need or a want or a pain point from our clients, and we either go, partner with a company to make that happen, or we go build it. But that's why I'm here and in my current role.
And Ryan, a little bit about what Rectangle Health does. I mean, is it focused on payer and patient payments? Can you talk a little bit about that?
Yeah, absolutely. So, that's kind of the great thing about Rectangle Health is we started off, we've been on the payment side, let's call it, of healthcare for 30 years, right? So there's just so many things that we've just been built from the ground up, that are built for healthcare, whether that's, being able to integrate to any EMR out there. Our software is HIPAA, PCI encrypted. So that's a huge relief for our clients as well. But the other nice thing is, especially in Donna's case, right, with organizations, with that many locations, that many employees, 9 times out of 10, there's a completely different software for engagement, right? Appointment reminders. There's a completely different software for financing. Sometimes there's another vendor for virtual payments, right? Text to pay or online pay. And then, kind of another thing that we added to our software or tech stack is compliance. Not just what we do on the payment side, right? The PCI compliance side of healthcare, but when it comes to actual, HIPAA, OSHA, right? Binders, training, we now encompass or kind of put that all together on one platform, or what we call the unified navigation. So now when we deliver, our clients can have, everything from pre-care to getting that appointment to card on file to post adjudication payments with payer sync and compliance all in one solution. So that's been one of the greatest things about Rectangle Health's evolution is, most of the time we're taking what most people are doing with 3 or 4 different vendors, and we're able to deliver that with one solution with Practice Management Bridge.
Yeah, that is a great point. There's a tremendous amount of solutions out there, and the problem is you're working with so many different vendors, and sometimes the solutions don't talk to each other really well, which can be an issue. Um, Donna, you spend a lot of time on the hospital side of things. What are some of the main differences that you see here when it comes to RCM in dental space?
And I think the difference between a hospital and dental is that hospital is probably about 30 years ahead of the dental industry in terms of not only market consolidation, but interactions with payers and patients. In my view, RCM in the dental space has a lot more friction and hurdles with, patient collections, payer payment receipt. It's more streamlined in the hospital space, whereas dental, it's a little bit more of a struggle, and it feels like the goalpost keeps moving and nothing is standard, and every payer has their own rules and requirements about how to submit a claim, how payments are issued. So, definitely is challenging, but therein lies the opportunity. And what was exciting for me moving from the medical space into dental.
And were you able to kind of bring some of the things that first of all, I think it's you said 30 years ahead. I was like, I've heard we're behind like 20 years. I never heard 30, so we're pretty far behind. But that is a pretty common theme that you hear that from the consolidation side of things, but then also just from some of the solutions that are out there as well. Were you able to take anything that you learned or in the medical space on the hospital side of things and apply that over at Great Lakes?
Yeah, I think there's certainly emerging technologies in the dental space, as Ryan was speaking about, and we're an adopter of what is called Payer Sync. That we had similar functionality in medical, and that is now coming to dental, where we can route electronic payer payments, which is normally, or many of them would come in as a virtual credit card, which just slows things down, costs money, of course, that we don't really have that in medical. So in the dental space, interacting with those virtual credit cards and having the hassles there to streamline that has really been beneficial for us. I think also one of the things that we have done with the support of Rectangle that has been transformational to our DSO is paper statements, which I know a lot of practices are getting away from paper statements. And maybe it's just a function of our patient population. We get better response from patients when we mail them a statement. We use QR codes for those that want to scan that and pay their bill in that way. But implementing paper statements, text to pay, and then having credit card on file has really been transformative for Great Lakes in terms of a patient AR reduction. When I joined Great Lakes, our patient AR was about $8 million. And with all of the technology that we have implemented and ways to reach patients, create a frictionless payment experience, we've brought that down to just about $2 million. And that we've done over the course of about 2 years.
Wow, that's huge. So from 8 million to 2 million in AR reduction. Wow. Okay, this is so how maybe Don, if you want to start this off, and then Ryan can tag in. How did the partnership really begin, and what were you looking to achieve? It sounds like you were looking to achieve, at least in large part, to reduce that AR, right?
Yes. So that was kind of item number one for me when I joined Great Lakes, being kind of struck a little bit by the $8 million AR level. And, I was questioning, how are we even communicating balances to patients? And we really did not have a good mechanism in place to do that. We were challenged with collections even at the office level as well. And then once the patient leaves, either has their braces removed or that cavity filled and crown placed, and they go out into the world, our opportunity of collecting that really diminishes. So our first step and the first thing we did with Rectangle was creating a patient statement that we mail out. The statement is it's beautiful. It's color coded based on the aging bucket that the balance is in. It has clear language on there of what code, the date of service, the patient's balance, where it's coming from, including any insurance payments and adjustments. So it was really transparent for the patient to see and understand in a very patient-friendly format why they owed that balance. Not to deride any prior company that we worked with before, but our statements before, or the information we were giving to patients before, was not as easy to understand. So I think it just caused patients to shut down and ignore anything that we were communicating to them in terms of balance. So now that we can present them with a very easy to understand, patient-friendly statement, that has really driven a better response. Along with the QR code, which, depending on the technology comfort level of the patient, we do get quite a few payments coming in that way as well. Text to pay is something that we implemented around the same time. And we see, depending on which office and where they're located, varying levels of response. Some of our more suburban or borderline rural practices, we don't get as much response with the text to pay, whereas our practices that are in the city and very close suburbs, really, we get a much better response with text to pay.
Huh, that's interesting. Uh, Ryan, maybe talk about it from your perspective coming in, working for the first time with Great Lakes. What did the situation look like from your perspective, and what were some of the things that Rectangle recommended to reduce that AR, and any insights from you?
Yeah, I was excited to work with Great Lakes. Donna has done amazing things with the software, and that's kind of one of the nice things about working with people like Donna and groups like Great Lakes is, when you see an opportunity to use software to your advantage and, work smarter, not harder, it's really nice to meet people and work with people like that, because I think, there's so many mindsets out there, treat them and bill them later. Um, you know, what's the ROI if I implement the software, right? There's just a lot of people who they kind of almost they're scared to take a step in in technology to make life easier and makes things more efficient. And that's the opposite with Donna, they work with us, vaulting cards, right? Putting cards on file for a threshold. The text to pay, bulk text features, payer sync for the post adjudicated payments, and they also utilize us for compliance as well, right? In all their organizations. So I think that was kind of the most exciting thing, is being able to work with a partner who truly understands that these tools lead to faster payments, more efficiency, and and a direct impact on EBITDA, right? Which is what most of our organizations are really focusing on. Um, and that's really kind of our mindset at Rectangle Health, is how can we make it better? How can we make it faster and more efficient? And how can we make it user friendly, right? That's another thing that I think I hear across my portfolio is, you know, all the things we built were kind of coming from, hey, what if this was like this? Or what if, can you guys do this? a lot of our updates are built from, clients telling us, can you build this? So that's kind of the beauty, is just getting to work with organizations like Great Lakes, and people really, taking technology and next steps, I think has been the best part.
And love to focus a little bit more on, the use of paper statements. So you transitioned, Donna, just so I understand and the audience understands. You had a system in place probably included paper statements, weren't quite as easy to read. You have QR codes on there now, so if somebody wants to actually pay via QR code, they can do that. You also mentioned that it seems like suburban and rural respond better to the paper than the text to pay. But you still feel that there is a need for paper statements, because you hear people moving away from paper. I don't know how much of that is actually true, but you do hear that.
Yes, and we have we feel that, or we have had better response from our patients with the paper statement. I know that while the industry maybe is going away from that, because there is cost associated with it, it has worked for us. It has worked well. We are going to look into, kind of automating some of that and using primarily only email and text. But from my experience, with at least our patient population, the paper statement just resonates better. And maybe because they can see the detail, maybe because it's something that they can hold in their hand. We intend to continue to use paper statements for the majority of our patient balance collection.
Brian, what do you see from some of your other clients? Is paper still pretty much used?
Yeah, I mean, I think the main call out I will say is, what Donna, obviously what works for their patient group, but the QR codes on those statements is kind of I think the unsung hero here, right? If I can, look at that, scan that QR code with my phone and pay at 10 o'clock at night or 9 o'clock after a busy day, then that is just giving me, it's kind of tying technology and, right, that that paper feel that they're all used to. Um, but I do think that's kind of the beauty of Rectangle Health, and what we do is, you know, all of our softwares, right? Everybody that we work with, it comes with the text to pay. It comes with a QR code that's, white labeled back to the practice. Um, and then we have options like paper statements. And I think that's the nice thing, is it's not a take it or leave it environment, right? It's really what works best for that particular organization. But I do see, a 50-50, probably more leaning towards a digital workflow and digital AR collection. But, there's always going to be a certain percentage of your population that's going to want that physical copy as well. So we like to just kind of, leave that up to the decision makers at the practices and at the organizational level, and deliver on whatever they need.
Sure. And obviously, it's working. You go from 8 million in AR to 2 million, so that's a huge accomplishment. So Donna, where do you go from here? You've reduced your AR. I mean, quite a bit is an understatement. A lot. So what is the strategy now going forward with Rectangle Health?
Yeah. So we've really, I think, kind of solved a lot of our patient AR challenges. And while our insurance AR is very clean, and not really any issues there, we are now working with Rectangle Health with Payer Sync, which allows us to be paid more quickly, because those payments route through and then it's direct posted from the Rectangle system, and then we can bring that into the PMS. So that we've been using Payer Sync for about 6 months now, with very good results, and it has reduced payment lag time from, gosh, depending on the payer, 2 weeks to a couple days. And so that has worked very well for us.
Ryan, could you go into some detail on exactly what PayerSync is and how it works?
Absolutely. Yeah. So, we like Donna so kindly mentioned is our software was built for that, in clinic pre-treatment, post-treatment environment. But there was a whole nother efficiency on the back end with payers, right? And once a claim is settled, right, that post-adjudication process. And that's where we saw a problem that just didn't have really a good solution, right? There's a lot of organizations, whether it's, virtual credit cards that are being faxed, right, printed. Sometimes you get a check, right, which takes FTE hours. There's a lot of human intervention. There's ACH plus, right? There's a lot of different ways. And if you're a 1 or 2 location practice, you're normally wearing 5 to 10 different hats, right? So having, parking yourself in a chair for 3 hours on a Friday to go ahead and take an hour or 2 to, input all that data is a huge pain point that we can solve. But then, furthermore, with organizations like Donna's is when you're at scale and you're talking about, 30 locations, we're talking, anywhere from 80 to $200,000 in revenue a month that is funneling this way, right? And there was really nothing that was making it faster or more efficient. So we actually created the software, which is known as PayerSync. And the best way to explain it is we have direct API connections to the main payers, and think of Zealous or Echo or Optum, right? Especially in the dental world. And now once that claim is settled, the funding, historically we're seeing 10 to 15 days faster funding. So Donna pretty much hit that right on the head. Everything of, actual business days. And then, 2 to 3 hours a week per location in FTE hours in actual remit, right? So kind of removing that manual entry of a VCC, removing the need to drive to the bank or, grab that check, input that data. And the other big efficiency is PayerSync has its own action tab within our software. So I can be running a payment, right, on in person, over the phone, vaulting a card, and then I get notified that I got a claim that came in. And the nice thing is that claim is it tells you everything about it. It tells you the payer, the full amount. Once you click into those claims, some claims will have multiple claims inside of it, right? Each PayerSync claim that comes in. It breaks out who paid, right? Whether it's Echo, Zealous, or Optum. It tells you the remit codes. And I think another big kind of efficiency that people have loved is the actual EOP, right? For that claim is actually digitized and stored in Bridge, which you can download and print. I think that's an unspoken thing that people love is, that was another frustration is all of these payers, their EOPs look completely different. So, data over here looks this way, data over there looks this way, and I'm logging into multiple portals to pull that information. And this kind of puts it all in one place. And it's just been a game changer for clients because it's a necessary evil, right? There's always going to be post-adjudication. There's always going to be insurance payments, especially in the dental world. And the bigger you grow as an organization, the bigger that number gets. So I think, especially in today's world with EBITDA and, cash flow, getting that, insert X, right? Like I said, 80 to 200 grand a month, getting that in 2 days is a lot more important than, wanting to wait 3 weeks because we're going to go be a check, right?
Yeah, absolutely. Donna, can you maybe cover some of the results that you're seeing with the use of PayerSync?
Well, just to build on what Ryan was saying, definitely shorter payment timelines. We're getting paid much faster, and I always feel good that when the providers notice that we're doing something right. I've had several of our providers say to me, I don't know what you're doing, but keep doing it because we're getting paid so much faster. Because most of our providers are paid on collections. So they're getting paid more and getting paid faster. So they feel like great about that. So I feel that that's a victory. And one other thing that I wanted to touch on that Ryan had already mentioned, that, we often receive, many, many patient payments on one remit. And it was a little bit challenging at the beginning to identify where they go. We use Dentist. They are our posting team, and they were a little bit challenged. And based on feedback that they gave, Rectangle was able to add the claim ID into the Rectangle portal, so then our posters could see and able to post very, very quickly. And that really dropped the time that it took for them to post the payment. So, the point there that I'm trying to make is that, the Rectangle works with you based on what your needs are and what you request, specifically to ease posting. And adding that claim ID was transformational for our posting team at Dentist. They spend literally seconds on to post an insurance payment on a particular claim. So it's really been a great experience for us. I know that the VCC fees that go along with it is, a challenge, kind of a bitter pill to swallow almost, and that nobody likes to pay those, but you often can't get around that. There's some payers that is the only way they will pay you. So if you're going to pay the fee, at least have built-in efficiency to get those payments to come in a faster and more productive way. So it's been a great experience for us using PayerSync.
So do you think that's why a lot of healthcare providers are hesitant to accept virtual credit cards? Is it really that fee? Is that the big hesitancy?
100%. Yes. And as much as we can, we try to get to ERAs or electronic remit, but not all payers do that. Many of the payers use virtual credit cards. I wish I knew why. I don't have an answer for that. So there's just some cases that you are not able to get around that virtual credit card. So we figured if we are having to accept those anyway, at least we can gain efficiency.
Excellent. So what else is on the radar for Great Lakes and Rectangle Health? You want to start off, Ryan?
Well, I was actually going to chime in one more, just a little bit on kind of just what Donna was saying, just kind of piggyback off of that. That's also kind of that's the beauty with Rectangle Health is there's no additional SaaS or transactional fees with our PayerSync upgrade due to the fact that we have partnerships with these payers now. So that's another nice thing that current clients are seeing is just basically automating that workflow. Another big thing I wanted to point out is I think a lot of people when they're shying away from that, post adjudication virtual credit card or, automating that process, they don't really factor in the time, right? The FT hours involved in the checks, right? The paper checks and the manual entry and the time that the staff has relief from them by turning on PayerSync. Another thing is, checks get left in, drawers, and so do virtual credit cards, right? If we get a fax or an email, we print it. I won't name names, but we actually just had another client very similar to Donna that's very, very happy with PayerSync. And one of the things that led them to us was a missed, payment of close to $70,000 that went missing for about 3 months until they found it in the office. And you can kind of imagine that amount of money sitting wondering where it's at. never having to worry about a headache like that because it instantly transaction funds once the claim is approved can be a game changer. That's obviously a unique scenario, but that's just one story, that I like to tell at least.
Yep. No, I'm sure that happens more often than it's probably most don't share that, but I
Yeah,
bet you that
yeah,
happens
that
a
was
lot.
he was very transparent. You gotta appreciate that.
So that is a great point you made there, Ryan, that there aren't any SaaS fees when you use payer syncs. You might have to deal with the fees with the virtual credit cards, which you're not going to be able to, at least at this point, get around with some payers, but no fee with payer sync. Um, yeah, so it's just going forward, talk a little bit about what the partnership looks like with Rectangle Health and Great Lakes.
Yeah, we are always growing with our technology. Growing with Great Lakes as well. I think the biggest thing or the biggest focus for Rectangle Health as a company currently is just really really trying to s- you know beef up payer sync, right? Our integrations with our payment vendors and software companies. um, you know, Always trying to be ahead of the curve on, uh, you know, upgrades that we can do for equipment and, whether that's contactless, right? Automation is a big thing for us. Automation of those bulk text to pay reports. And then, of course, our- getting more payers into the PayerSync portal. We really want to make sure at some point that every claim possible is ingested and sitting there waiting for our clients.
And Donna, as far as Great Lakes, are you focusing still on organic growth there, or there is you going back? It's seem first off, Donna, you're in like the most popular position in the DSO space now. Nobody knew what RCM was 3 years ago, and then interest rates started to climb, and now everybody's focused on RCM and organic growth. So can you talk a little bit about strategy for Great Lakes in 2025?
Yeah, it just same store organic growth. We do not have any acquisitions in the pipeline that we're targeting at this time. We are considering opening another or reopening one of the practices that we had closed at one point, reopening that as like a de novo. So we're excited about that. But to answer your other question a few minutes ago about other things that we're working on with Rectangle, I can't I can't help but mention the compliance tool that we have with Rectangle. I'm also the compliance officer for Great Lakes, and that has really been transformative to us. We really didn't have anything in place prior to manage and monitor and oversee compliance, from HIPAA, OSHA, CDC required training. So that's something that we've rolled out now about a year ago with Rectangle. So it houses everything from a compliance standpoint in one place. So required annual training. Should there be an OSHA related incident or work related incident for an employee, you can house all that there and report on that as well. We have annual state reporting on OSHA that we have to submit. And so it's been much easier to have that all housed in one place.
Excellent. Okay. Ryan, anything you want to talk about with that compliance solution?
Yeah. Thank you for bringing that up, Donna. I do think that, you know, unfortunately, compliance is never, something that people want to talk about, right? It's also something that is non-negotiable when it comes to HIPAA and OSHA, right? So these trainings are required. Um, new employees, especially in the dental world, I think that's one of the biggest problems that our compliance software solves is the turnover. With us, with our software, we don't care if you have 50 employees in one location or five. If you get a new hire, you assign them into the portal and they go do their training. It's really cool because it's built directly into Practice Management Bridge. So I could, once again, kind of our mantra here, right? A unified platform. I could be taking a payment, running a card on file, taking a phone payment, and then go do my training, right? All within one portal. And I think historically, if we kind of rewound a couple of years, most of our locations, they were bringing someone in once a year. Obviously, that's not free. They were shutting down the practice for 2 or 3 hours, right? Which, depending on the volume that practice produces, that could be $2,000 or $3,000 in revenue, right? That one day. And then if I get a new hire 4 months later, now what do I do, right? So that's kind of where, the compliance software, once again, it's built for scale. There's an enterprise dashboard that we actually build with all of your users, all of your locations. Someone like Donna can log in as her user, and that would be considered an admin user. And she can look at her whole organization and drill down per location on, who's completed what users have done their trainings. And the same thing goes with OSHA, right? All of your kind of self checklists are in there, your Sharps reports, right? Incident reports, the OSHA 301 forms are built in. So it kind of, we basically reverse engineered an audit, to be honest, and we built it to kind of have all the information you need to be compliant and to make it quick and efficient, but removed all the junk that isn't sometimes necessary. And then, of course, I think the other big thing I always like to point out is not only does our software give you training, HIPAA, OSHA requirements, at a state level, but there's also 1,300 hours of CE credits. So that's the other great thing, is each training comes with CEs. There's also a CE credit portal that people can go into, type in whatever they want. And then last, but certainly not least, your digital binders, right? So I know it sounds silly, but unfortunately, if you walk into a practice and you say, hey, show me your binder, you're probably going to get a 50-50, answer. One, someone might say, I think it's in the closet. Two, they might know exactly where it is, but maybe it hasn't been updated in a year or two. And unfortunately, that is one of the first things that they would ask for, God forbid there was a breach or an audit, is they would ask for a binder to make sure your policies and procedures were up to date. So I think that's another kind of efficiency that people love. As simple as it sounds, is we actually digitize your binders for you, all of your policies and procedures. And if there's ever an update, right, within the year, whether it's HIPAA or OSHA, we actually update that on the back end for you and email you a copy of that new policy to add to your binders as well.
That's great. That is something that's certainly needed. Like you said, it's probably not talked a lot about, but it's certainly important. And I think if you do get called out, and how many people really are prepared and have the supporting materials when it comes to compliance. So,
Yeah, it's important to take a preemptive strike for
Yeah.
sure, because taking one after something's happened can be very, very expensive, unfortunately, and detrimental. So that's where, it's one of those necessary evils. We like to make it easy, right?
Absolutely. Ryan, if as we kind of wind things up here, if anybody in the audience, whether they have a single practice or they've got a merging group or a larger DSO, somebody like a Great Lakes, if they want to find out more about Rectangle Health, what's the best way to do that?
Going directly to our website, all of our features and functionalities, rectanglehealth.com, they're all broken out. There's great information on there. You can request a demo. I would say definitely best next steps, if there's any interest in anything we talked about today, right? Whether that's payer sync on its own, compliance on its own, payments on its own, or a bundled version of that, very similar to how Great Lakes is built. Happy to help set that up, and go into the website. They'll be able to request a demo.
Excellent. Thank you, Ryan. And we'll make sure we put the Rectangle Health contact information in the show notes. You can go to rectanglehealth.com, and certainly great, easily navigated website. You can find everything you need there. Rectangle Health's also listed in our Group Dentistry Now DSO resource guide, so you can find more information there as well, and I'll put that in the show notes as well. How about you, Donna? If anybody wants to find out more about Great Lakes or needs to talk to somebody else in RCM in the DSO space, what's the best way to get in touch with you?
I can be found at greatlakesdental.com. My contact information is there, but certainly I can provide my email separately as well.
Excellent. Okay. Well, thanks everybody. Thank you, Donna, and thank you, Ryan. Great conversation today, and you got a lot of great things going on. Kudos to you, Donna, and the team at Great Lakes for bringing that AR down. I mean, it's just $6 million reduction in accounts receivable is a huge number, so it should really be it should be celebrated for that. You want to get it down even more, of course. That's awesome. And thank you, Ryan, for being on the show, and congratulations to everything that Rectangle Health is doing. And thank you, everybody in the audience, for listening to this podcast. Again, without your support, we couldn't do this. Until next time, this is the Group Dentistry Now show, and I'm Bill Newman.
The Group Dentistry Now show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today, and please tell your colleagues about us.